This is North Coast Perspectives. I'm James Faulk. Thanks for joining us. A new statewide designation system for the severity of COVID outbreaks in California's counties has meant some good news for Humboldt County. Some area restaurants and businesses will be able to reopen in-house dining and other services as long as our infection numbers stay relatively low. Again, this puts the onus on area residents to take the pandemic seriously and wear masks, wash hands, and stay socially distant. But so far, Humboldt County's reaction, from health officials and area leaders on down to members of the public, has been effective enough to keep our COVID numbers relatively low. Yet the one person who should arguably get the most credit for these efforts has just this week submitted her resignation as county health officer. Dr. Teresa Frankovich is someone we've all come to know these past few months, and her leaving puts Humboldt County in a bit of a predicament. She'll stay on until the county finds a suitable replacement, and even after, but only on a part-time basis. We'll have more on her departure in a moment, but whoever the county chooses to take the helm, they'll likely face the same political pressure and backseat driving that plagued Frankovich during her very successful term in office. It's understandable that in 2020, a year of political strife, pandemic disease, racial unrest, and social division, some would fall victim to the rampant misinformation and lies to be found in so many dark corners of our national psyche. Those often illogical and ridiculous ideas found an often hospitable reception in parts of Humboldt County. Let's be clear. Frankovich's departure is due, according to her letter of resignation, to unmet family obligations. But the vitriol that met many of her decisions and judgments certainly didn't help make her job easy. For her successor, and for the ultimate success of our county as we continue to wrangle with this disease and all its complicated fallout, let's try to remember that we're all on the same team, fighting for the same goal: saving lives and livelihoods, one well-considered move at a time. Humboldt County Health Officer Teresa Frankovich tearfully announced this resignation this week by pointing out how strong and successful her team has been in meeting such an enormous health challenge.
Dear Humboldt County residents, I want to let you know that I'm resigning from my position as the health officer for Humboldt County. This has been an incredibly difficult decision, but while it has been a privilege to work with this county's talented and dedicated public health and emergency operations center teams, the emergence of COVID-19 and the response it requires has changed the health officer position from the very part-time one I stepped into back in late January to one which is more than full-time. It has also become clear that this level of commitment will be needed for the duration of the event. I was happy to accommodate this need in order to help the county swiftly respond to the pandemic at the outset, but now I need to make good on some promises to my family. Over the past 7 months, public health, the emergency operations center team, and community partners have built expansive new infrastructure to respond to COVID-19. There is markedly improved access to testing in Humboldt County, with our internal lab now able to run over 200 specimens per day, in addition to our Optum site, an alternate care facility which will be used by our hospital partners in the event of a surge, robust and expanded contact tracing capacity, and a congregate setting task force that has worked to help long-term care facilities protect the most vulnerable in our county. Through the Joint Information Center, we have provided ongoing education and information to the residents of Humboldt County so that everyone is empowered to become an active partner in efforts to control the spread of COVID-19 locally. The JIC has also been central to the business plan review process, which has helped local employers develop a safer workplace for their staff and their customers, benefiting the entire county. The EOC has been well designed to expand or contract as the pandemic requires. Still, there is work to be done to ensure we are well positioned to minimize serious illness and loss of life in our community in this ever-changing landscape. Recently, new challenges to testing access have emerged as the state contract with Optum is slated to expire at the end of the month. We have been exploring all options in the search for more responsive testing capacity. A new alternative being planned through an innovative regional partnership should bring ample and accessible testing to all residents of Humboldt and Del Norte counties, including tribal communities. This will be an enormous asset for our county, and it would not have been possible without the vision and hard work of this team. COVID-19 response in some form is likely to be needed throughout much of 2021. As I am unable to continue in this full-time position for that duration, it makes sense to plan for a replacement at a time when we are in a fairly stable position and not in the middle of a surge in activity. It has been a pleasure working with Director Stevens, Dr. Ennis, and everyone involved in this massive undertaking. I am proud every day I walk into this building and the EOC. I am grateful for the opportunity I've had to witness firsthand the integrity and commitment of an amazing team, and for the incredible support of many of our elected officials and community members who embody the best of what drew me back to Humboldt. To the many who have written cards, letters, and emails to voice their support of me and the entire COVID-19 response team, I want to say thank you. Your kind words and your efforts to keep Humboldt residents safer have energized all of us in public health and the EOC during this challenging time. I believe a candidate with the leadership skills and expertise needed to continue this work will step forward to help navigate Humboldt through the next phase of response. The plan is for me to continue to serve Humboldt County in a part-time capacity under the new health officer and the deputy health officer, Dr. Ennis, to provide whatever assistance I can for the community going forward. Humboldt is my home. Thank you.
Mike Wilson, 3rd District Humboldt County Supervisor, reacted to Frankovich's resignation in an interview with KEET TV by expressing gratitude toward her and the health department as a whole.
Well, I mean, the reaction is that, I feel like we're really lucky to have had her for as long as we have, considering, she was hired and the expectation was that job was to be part-time. And so, which quickly became a more than full-time position. And so I think that considering that that change, and that she's really given this community a great service, has done a wonderful job, has been a great leader, and just really worked within a very dynamic situation very well. And so, she really did that for as long as she really could. She has, as was in the press release that she put out in her letter, she has some pretty significant family obligations that she had been anticipating to be able to do as a part-time public health officer under normal conditions. And that we've gotten to a place where it's just hard on her to do that work. To deal with those family obligations, but understanding that she's not gone in the current context. she will be on until we hire somebody that will replace her directly, and also she'll be still working for County Public Health part-time, so she's on the team. Yeah. So I feel like really we've done well, and she's given a great amount of service to the county that was beyond what was expected.
Yeah, absolutely. Who knows, the pandemic's going to get dropped in your lap, right?
Yeah, exactly.
Now, the process, I guess, is getting underway to find her replacement. How does that look, and what are you looking for in someone who would take the helm?
Well, generally speaking, our processes are, I haven't seen what's come back from staff in terms of what the particular process we're going to have for this. It could be a little different considering the situation that we're in. Although, it's always nice when a person or one of our department heads is there for the duration, so we're not without one during this time. We'll evaluate with our human resources director about the process for that, whether we do a nationwide search, whether we do a local search. We really evaluate that on an individual basis, or a per time basis. And so we'll see. I haven't seen what that recommendation is, because again, her announcement was just a few days ago, and we're not in a big rush necessarily, because we want to do it right, because she's still on the job and has committed to stay on until we find somebody else. So we'll see how that goes. And I want to say she has been, part of her leadership has been really creating a good team around her. Dr. Joss Ennis, who's many people have seen, has been integral in that process, as well as Michelle Stevens, the deputy director. So I feel there's the continuity is there, and I'm not. It's not a big concern right this time. I don't see any reason that we can't make this transition in a very positive way.
Yeah. One of the concerns it seems like this position is a magnet for criticism and conspiratorial thinking. There's been a lot of pressure put to bear on her, and I know that that's not the reason that she's singled out as the impetus for her to leave, but that has to be a concern for anyone who takes this job. What's your message to those folks who've been critical of the public health officer, and what do you say to them in case they may want to do that to the next public health officer?
Well, first I would tell the public health officer not to read the comments on the blogs. We'll start right there, and stay away from the comment sections of the Facebook and all those other things. And that's wonderful for everybody's mental health in these arenas, for sure. And I think that Dr. Frankovich did a wonderful job of that. The pressures and that came in those discussions, from the public, I don't think, those mostly came through maybe supervisors, and I don't mean that supervisors were putting undue pressure or anything like that. This is not what I mean. What I'm saying is that, like, we would let her know what constituents were, had concerns about, and oftentimes they were really pretty, valid questions and concerns. And you're right, there are just some kooky, conspiratorial, and very agitated responses to these things, and one might imagine that there would be. I mean, these are, this is a time when there is a lot of anxiety. People's jobs are being impacted, and we're in this highly politicized space, all the way from our nation's leaders all the way on down. But I would say that just do the job, and everything's will work itself out. To be honest, we've seen in our own bubble that those conversations, and I will say that what we're hearing from public health officers around the nation is that we're probably not the tip of the spear in terms of like the amount of craziness that other places have experienced.
Sure.
By any means. It exists, but it hasn't had at least from where I'm standing and from what I've seen in terms of the public health staff, it hasn't had a whole lot of impact. I mean, the real issues that impact them are people's genuine concerns related to business openings and closings, and the confusion of that in the schools, and the psychological toll, and that this all takes, as well as being just the real weight of the job itself. That noise over on the side just is pretty small relative to the real issues.
Yeah.
So that's been my experience.
Yeah, when we talk about the real issues, I mean, yeah, it's like balancing the need for economic activity and growth versus the need for public health, which is really the crux of where the issue lies in a lot of this. Let's dig into that in terms of the county. How have the county's finances been impacted overall by COVID, and how long do you anticipate the county's going to need to dig out from under that?
Well, the county finances, per se, on a relative term, the hit hasn't been as bad as maybe some other jurisdictions. Certainly because we don't have as big of a cut in the retail sales. It's not as big of a part of our revenue generating as it maybe is for like cities and things like that. And some of our sectors have been doing pretty well, like the agricultural and cannabis sectors are doing fairly well. And we are also, property taxes is also a big part of our revenue. So that's also, any impact of that would be pretty delayed. So we have had some impacts. We are asking departments to look at cuts, but it's not anywhere near what, in terms of relative percentage to what some of the sort of city jurisdictions have been seeing. Yeah. So from that perspective, we're just basically taking a very conservative approach to our finances. and basically trying to slow or stop spending wherever it's possible. And as far as I can tell, the departments are adjusting and adapting to that.
We have about a minute left, but one thing that's really interested me in terms of the impact to the county and how things have had to change is the way the county has had to change the way it operates its jail, basically. They put less emphasis on nonviolent crimes and try to save jail space for people who truly need to be there. Do you think those reforms might eventually work themselves out to be kind of a more permanent approach, or is this something that will strictly last as long as necessary with COVID?
Well, I don't know. I mean, that's a really good question. We're seeing that in all sectors. I mean, it's not just, in terms of criminal justice, we're seeing land use issues being dealt with on an ad hoc basis that we don't know whether that's going to change. We're seeing public comment platforms being very different. I think we're going to see changes across the board that are going to stay in place. I mean, even down to, it's quite possible how the rules for sport are changing. So I would say that it's a good chance. It's a good time to evaluate what we've seen as long-term constructs that we just thought were just always going to be there, or just were because this is albeit not the exercise you want to do to challenge these things necessarily, but it is forcing us to really rethink just about every level of how we manage the rules, or whatever they may be. So, and I encourage everybody to really be thinking about that at every level, because we're learning a lot.
Lastly, how have you personally been impacted? I mean, you mentioned before we got on the air that you've had 11.5-hour days on Zoom. I can only imagine how awful that must be.
It is pretty brutal. Yeah, it's I'm in the office today for a little bit. I come in once a week to kind of pick up stuff and that sort of thing, mostly working from home. I have my kid there doing the school stuff. That has just been it's definitely stressful. I'm grateful that I have work to do, and from my perspective, fulfilling work that keeps me more than occupied. But yeah, the 11-hour with 3 days in a row, Zoom meetings is unprecedented, and part of that comes from a new level of public participation that's been created through this type of access, right? Yeah. I had a meeting last week or a couple weeks ago, where literally the person giving testimony was in the passenger seat of a car moving down a highway, right? So are the constructs of how we receive that information, and that is just so different. And again, in a year from now, I keep saying, it's like a year from now is not going to be a year ago. It's just, there's going to be things that are going to be very, very different, and we should be really looking for ways in which we can improve on all our systems, even though currently right now it's, this is hard times.
Eureka Mayor Susan Seaman also thanked Frankovich for her hard work these past several months and said the department is in a good position to continue its mission of protecting the public.
We had big news this week when Dr. Teresa Frankovich announced her resignation as Humboldt County's public health officer. In her position, Dr. Frankovich stayed focused on her mission, and she's been resolute in her leadership through a very intense 6-month period. Right now, Humboldt County's COVID rating is orange, which is moderate, compared to a vast majority of the state, which is rated as red or purple, meaning substantial or widespread. There's a difficult paradox when a disaster is mitigated. If guidelines work, it feels like the sacrifices we're being asked to make are unnecessary because things aren't as bad as they could be. Right now, things are not as bad as they could be. And we can continue to keep our numbers low by following the current guidelines and adapting to changes with guidance from the new leadership, who will begin their position with a good foundation provided by Dr. Frankovich. Dr. Frankovich, from the city of Eureka, thank you for your service.
Despite some significant controversy, Humboldt State University is seeing quite a few more students than expected this fall, with enrollment coming in above projections for both new and returning students. According to an HSU press release, following the first week of classes, 6,471 students are enrolled at Humboldt State, While that is 7.5% fewer than last year, it is far better than the 20% decline that had been expected due to recent trends and the impact of the pandemic. New transfer students, in fact, have increased by more than 14%. HSU has welcomed 943 new transfers, 119 more than last year, and the most since 2017. In addition, the school first-year retention figure of 75% is the same as last year. According to HSU, 500 first-time freshmen are enrolled this year, which is 50% more, or 50 more than had been expected to fight the expected downturn in registration numbers. School officials undertook several programs to raise enrollment. At this point, those efforts seem to have paid off. The numbers won't become official, however, until late September. Frankovich is still at the helm of the county's health efforts for the time being, advised area residents to be careful this Labor Day weekend and stay away from large groups that pose a larger risk of infection.
I did just want to mention the holiday is upon us, Labor Day weekend, and I know that that's, especially in a beautiful area like Humboldt, it's traditionally a big outdoor and a gathering time. I just want to emphasize to people that we're in a relatively good place right now, and the reason for that is that most of us have been doing a really good job at trying to, not gather, trying to distance and use facial coverings and all of that. And it's never more important than when we're having a lot more activity going on. The success for all of us going forward is contingent on all of us still doing our part. So I just like to ask people to be sensible and ideally, if you're going out to the beaches, if you're going to do something, do so with your household unit. If you are going to be with people who are not part of your household, the smaller the group, and I'm talking like 4 people, 6 people, not 20, not 30. The smaller the group, outdoors, using facial coverings and distancing is the safest way to do it for all of us.
We'll be right back after this short preview of this week's episode of Frontline.
We don't have school because of the coronavirus. My schoolwork is not very well.
They are growing up in uncertain times.
When we say we don't have money, we really don't.
The experience of poverty through the eyes of children.
I think anyone can end up how we are, being homeless.
When I get older, I would want to live here. I want to get a good, stable job.
Sometimes life just happens and things go the wrong way.
Mayor Seaman this week also described how wildfires across the state have taxed local firefighting agencies and asked that residents keep that in mind as they manage their own fire risk. She also praised efforts at a Eureka Recycling Center to help vulnerable populations keep isolated during the COVID pandemic while still getting the services they need and deserve.
It's good that we're seeing some fire containment through the state, but we're also hearing about extreme heat conditions over the weekend. Locally, we often refer to ourselves as a climate refuge, and we get comfortable thinking fires are a low risk for us. But fires throughout the state do affect us. In fact, Humboldt Bay Fire has crews out in Salinas, and they don't have an expected return date. That leaves fewer crews here locally, and while we haven't experienced large forest fires, we have seen several fires in the Humboldt Bay area, in barns and in garages. This is a reminder that we need to do what we can to keep our homes and neighborhoods safe. This week, we also saw the reopening of the Eureka Recycling Center on Hawthorne. The center is now open for CRV buyback Tuesdays through Saturdays. This is the only recycling center in Humboldt County, and lines so far have been substantial. You're encouraged to delay your visit or anticipate a longer than usual wait. In any case, please be patient and courteous with the crew. They'll be working with new protocols while receiving more materials than usual. Please arrive with your materials pre-sorted, wear a mask, and maintain social distancing. Seniors and immunocompromised individuals may drop off their materials from 8 a.m. to 9 a.m. All other customers may visit the site from 9 a.m. to 4 p.m. Another great program that's restarting is the Eureka City Schools Meal Program. Eureka City Schools announced this week that once again all children ages 18 and under can pick up meals at no charge, whether they attend school at Eureka City Schools or not. Meals will be available beginning Tuesday, September 8th. And for any questions about how to get them for your family, contact 707-441-2501.
The remains of a body found on August 20th in Hoopa have been identified as that of missing person Julius Barthel Tripp. Tripp, age 42 of Hoopa, was reported missing to the Humboldt County Sheriff's Office on July 26th. A vehicle associated with TRIP was reportedly located on Highway 96 by the California Highway Patrol and the Hoopa Tribal Police Department on July 24th. The agencies requested the assistance of the Sheriff's Office after searching the surrounding area for TRIP with no results. Through further investigation into this case, Sheriff's deputies determined that TRIP's disappearance is suspicious. So they later issued an arrest warrant for 18-year-old Bronson Moon Lewis Jr. Lewis surrendered peacefully into the custody of the Humboldt County Correctional Facility on August 26th on suspicion of homicide. Efforts by the North Coast Regional Testing Partnership will soon make it possible for nearly 9 processed locally each month. The expanded testing arises out of a partnership between United Indian Health Services, Del Norte and Humboldt counties, Humboldt State University, and tribal communities, as well as a contract between the state of California and Perkin-Elmer, a global company software. The ramped-up testing is expected to be available starting this fall. Once up and running, tests collected in Humboldt and Del Norte counties will be processed at either the Public Health Lab or at United Indian Health Services. Each county will be responsible for designing its own collection system, and tribal partners will be aiding in designing and operating those systems. That's it for this week. Here's to another week of good health for you and yours in Humboldt County and beyond. Next week, we'll be featuring another poet from the Behind the Mask collection of local COVID poems, as well as an interview with the chief of Arcata Fire. He will be talking about a ballot initiative facing that community this year in November, and that will, he says, help his department to save lives. Stay tuned, stay informed.
Welcome to a scientific revolution.
Well, we're hardwired for certain kinds of really serious mistakes. And the spirit in which one should approach this fallibility isn't shame. It's let's try to understand it and do our best to correct for it.
We'll find out why this scientific revolution offers tremendous hope.
When you learn more about how the mind really works, I think it should give you an incredibly optimistic view about the future.